In the remote highlands of Den Quang, every mother is facing an emergency. Her baby is sick and she is holding a medical form full of jargon she cannot read. This complex information becomes invincible under the stress. For mothers of Thai ethnic minorities, critical health resources are locked behind a language they cannot fully understand. Therefore, maternal mortality here is 3 times higher than in lowland areas. The information creates gaps, creates panics exactly when the time matters the most. Standard tools fail here. They cannot read a physical paper document. They can understand the local dialects. That's why we built the ViTeM, an AI framework engineered specifically to turn complex medical advices to immediate step-by-step actions. Under 30 seconds, ViTeM threw away overwhelming terminology to transform the confusion into clarity through 3 steps.
First, it reads the physical medical document, extracting only what matters most. Second, it translates that clinical jargon into both simplified Vietnamese and the native Thai language using culturally familiar terms. And finally, it classifies the case into tiers: green for routine, yellow for midwife review, and red for emergency, which escalate to a doctor when danger signs are detected. So this is the demo of our system, ViTeM. These are some information. And let's get started. First, we get to log in. There will be 4 rows, and each row has an individual page for works. Firstly, I will log in into the patient. As you can see, this is a page for the patient. As a patient, you are able to send picture, contact phone number, and common symptom for yours. You also get instruction in Thai if in need. I'll do an illustration. I send this photo to doctor, and then the AI will processing the data, and by the confidence, it will have it turn to red, yellow, or green cases. This is yellow case, and it's sent to the midwife. And this is the page for the midwife. As you can see, there will be a dashboard for conclusion informations, verification queue. This is the patient that sent the paper before, and the midwife has 2 options: or to send back tips to the patient, or send it to the doctor for treatment.
One more feature in our system is the confidence score. The confidence score is calculated based on 3 factors: image quality, how clear and readable the photo is, text clarity, whether the document is printed or handwritten, and document complexity, how much medical jargon it contains. The higher the score, the more confident AI is in its analysis. If the score is low, we'll automatically flag the case for human review, regardless of urgency.
This is the page for doctor. Doctor also has the ability to send tips and treatment to the patient. If it's a red case, the AI will directly send the symptom to the doctor. Turn back to the patient page. It's all set. There's one more row, is the manager. The manager has the ability to call ambulance for patients if in need. As you can see, there's a demo patient here. He had the ability to call an ambulance to the place that the patient are at the moment and take them to the nearest hospital.
So, what our project actually changed? Let me show you the difference. Before ViTeM, a Thai mother received a medical document she cannot read, panicked and confused. She has no way to understand, no way to act, and no connection to care.
Now with ViTeM, she takes a photo. In under 30 seconds, she gets a plain language summary and a step-by-step checklist in her own language. She knows exactly what to do, when to see the doctor, when to take a medication, or what danger signs to watch for. If it's an emergency, the doctor is alerted immediately. She goes from fear to confidence, from confusion to action. That is the social impact we're aiming for. And now, that is ViTeM, intelligent maternal care for ethnic mothers. Thank you for your listening and watching our project.